You wake up one morning, a severe headache, a high fever, a never-ending cough. You reach out your hand for your phone. You ask Google, and it tells you that you need to see a doctor. The very first thing you do is go to a doctor and get treated. You use the medications recommended by your doctor and recover. But what if you were in ancient times? What could you have done? Mesopotamian. If you were to fall ill during the Mesopotamian era, your diagnosis wouldn't be made with a blood test. The diagnosis would be made by a priest looking at the stars or examining the liver of a freshly sacrificed sheep. In Mesopotamia, people rarely believed that diseases were a biological malfunction of the body. To be honest, illness was the direct result of an evil demon possessing your body, or a god being deeply annoyed with you. If you lied, cheated, or trespassed on your neighbor's land, the gods could leave you in the hands of Lamashtu, the terrifying demon held responsible for infant diseases and high fevers. When you fell ill, two important figures of Babylonian medicine could walk through the door: the Ashipu, meaning the sorcerer priest, and the Asu, meaning the herbalist physician. The Ashipu's job was to find out exactly why the gods were angry with you. He would recite prayers, burn incense, and organize magical rituals to drive away evil spirits. The Asu, on the other hand, focused directly on physical symptoms. He washed wounds and applied plastered bandages. He prepared herbal medicines by mixing resin, mustard, and beer. As funny as the rituals applied by the Ashipu to cure a toothache might sound today, the Asu was quite knowledgeable about diseases. Clay tablets, such as the famous Diagnostic Handbook, show that the Mesopotamians cataloged hundreds of plants, minerals, and animal products. For example, they used willow bark to treat pain and inflammation because the salicin contained in willow bark carried a chemical link to today's aspirin. Egypt. We can say that ancient Egypt's medical power was much higher than that of other societies of the period. So, what was the reason they were so good? It was their belief in life after death. Thanks to mummification processes, Egyptian embalmers found the opportunity to constantly examine human organs. Thus, they developed new treatment methods. Since honey is a natural antibiotic and antiseptic, it was applied to open wounds and burns to prevent infection. They also pressed moldy bread onto infected wounds. This was a genuinely effective method applied long before the discovery of modern antibiotics. Along with this, they treated patients with surgical instruments they developed. They used scalpels, scissors, and needles to make incisions or clean tumors. To treat fractures and dislocations, they stabilized the broken bones with wooden splints to ensure they fused properly. To stop bleeding and destroy infected tissue, they also performed a cauterization process by heating metal instruments in fire and pressing them onto the wounds. Ancient Greece. If you went to a classical medical clinic in Athens before the Common Era, you would see that magical treatment methods had been replaced by philosophical ones. During this period, Hippocrates, known as the father of medicine, rose to prominence. He discovered that epilepsy, which was called the sacred disease at that time, did not originate from angry gods, but from completely natural and physical imbalances in the human brain. The Greeks believed that the universe consisted of four elements: earth, air, fire, and water. Therefore, they thought there must be four corresponding main fluids in the human body. Blood corresponded to spring and air. It was hot and moist. Phlegm corresponded to winter and water. It was cold and moist. Yellow bile corresponded to summer and fire. It was hot and dry. Black bile corresponded to autumn and earth. It was cold and dry. If you had a fever, your body was clearly producing too much blood because blood was hot and moist. The solution was to get rid of the excess blood. This thought gave birth to bloodletting, the process of draining the patient's blood by opening a vein or applying leeches. If you were sluggish and constantly coughing up mucus, you had an excess of phlegm in your body. The doctor would prescribe warming foods, hot baths, and expectorants to dry you out. Asclepians, on the other hand, were like the wellness spas of the ancient world. These were massive healing centers dedicated to Asclepius, the god of health. Patients spent their days exercising, listening to music in the theater, entering thermal baths, and following strict, clean diets. It was like a luxury detox center rather than a hospital. The most important ritual applied in these centers was temple sleep. Patients slept in a sacred dormitory called the abaton. According to belief, Asclepius would visit the patients in their dreams at night and either operate on them or tell them which medicinal herb they should drink. Rome. Roman medicine reached its peak, especially in two areas: war surgery and public health, because Rome wanted to keep its legionary armies alive and vigorous. If you were a wounded soldier, you would immediately be taken to a valetudinarium, meaning a military hospital. There, a highly trained army surgeon, a medicus, would pull out a bag containing instruments that looked almost identical to modern surgical tools: scalpels, bone levers, forceps, and medical speculums. If you were wounded, you would be carried to the valetudinarium. The medicus would remove the arrow, and then he would either cauterize the wound or wash it with vinegar. Roman surgeons were truly master physicians. They routinely performed operations such as amputating limbs to stop the spread of gangrene, drilling the skull to reduce internal pressure caused by head traumas on battlefields, and cataract surgeries. Actually, the reason for Rome's greatest success in the field of medicine was not a surgical instrument or a medicine. The most important factor was the aqueducts. Yes, aqueducts. The Romans realized that clean running water and the sewage systems they developed prevented diseases that caused great harm to society. By building massive public baths, toilets, and sewage networks, they removed dirty water and waste from the city. Thus, they prevented many diseases. There was also another plant that the Romans valued greatly: silphium. The Romans loved this plant, which grew only on Libyan soil, so much that they used it both as a medicine and a food spice. It was so valuable that its image was stamped onto official gold coins. Due to overuse, the lineage of this plant became extinct in the 2nd century AD. In recent years, some studies have determined that the plant name Ferula drudeana, which grows endemically in Turkey, especially in the Cappadocia and Mount Hasan region, has incredible similarities with ancient silphium. Willow bark, on the other hand, was the painkiller of the ancient world. From Sumerian clay tablets to Hippocrates' books, it is mentioned that chewing willow bark is good for arthritis and labor pains, because the willow tree harbors the raw material of today's aspirin. Interesting methods. The famous Roman naturalist Pliny had written massive encyclopedias, and some treatment methods were truly strange. Pliny recommended that if your tooth ached, you should catch a frog in the light of a full moon, spit into its mouth, and tell it to take your pain away. For general skin infections, ancient pharmacists frequently prescribed crocodile dung mixed with crushed snails. Even though it sounds disgusting, animal droppings could dry out rashes thanks to the ammonia compounds they contained. Of course, as long as it didn't kill the patient with a fatal infection. If you had a stubborn cough or a skin ulcer, ancient physicians wrote microdoses containing arsenic, lead, and mercury for centuries. Since these heavy metals are extremely toxic, they genuinely killed surface bacteria and parasites quickly. Unfortunately, in long-term use, it also killed the patient themselves by creating systemic organ failure. Of course, there are many more treatment methods that we cannot count. So, what do you think now? Should we be grateful for having so many treatment methods today? Or do you shudder for a moment imagining that you were sick in those ages? Sounds terrifying, doesn't it?